Hi there, my name is Carrie, and I am a new patient of Dr. Chia. He is a specialist in CFS ME, and I'm making this video to kind of document my progress with Dr. Chia. I'm going to talk a little bit about my appointment with him. I'm going to talk a bit about what he's prescribed for me and my treatment. And I'm also going to talk a little bit about what led up to my chronic illness and about my journey within that chronic illness. So if you are looking for a review of Equilibrant today, this is not the video for you. That is something that Dr. Chia prescribed to me. I'm going to talk about that in this video. But I literally just took my first pill. I'm going to show you all of that. But if you're looking for more of a review, keep watching my videos and hopefully we'll see progress. I also want to give a huge shout out to Jennifer Brea. And I really want to encourage all of you who are either suffering with this disease or have family members, friends who are suffering with this disease, please watch Jennifer Brea's film Unrest. Dr. Chia recommended that I watch it. I did not want to watch it. In fact, I've been in denial about all of this for a very long time. I've been hiding my illness. Even my closest friends that have seen me sick don't really know how sick I've been. There are very few people who've actually seen me really sick. And I did watch Jennifer Brea's film, and I was completely shocked in the first 20 minutes of how similar her symptoms were to mine. And I was just so in awe of how she took this head on. And it really inspired me to make this video and a series of other videos. And I'm really hoping that me doing this can help others, and that also it can maybe help me connect with other people who have similar experiences. So here we go. My appointment with Dr. Chia was a long time coming. I didn't even know he existed until last year. I found him through a neurologist here in Long Beach who I went to see for my migraines that were really increasing. And he said, "This is who you need to see, Dr. Chia. Call him now. It's going to take forever to see him." And it did. I made an appointment for 6 months out, and it was totally worth the wait. I had a bunch of lab work done. You have to have a series of lab work done before the appointment. And so I went in, and Dr. Chia sat with me for an hour and a half, going over my whole health history, even from when I was a child. And for those of you who don't know of Dr. Chia, look him up. I may be repeating myself. I've got huge brain fog, so just bear with me. Dr. Chia believes, and he's found in his research, that CFS is caused by enteroviruses. He's actually seen this in his research. And his son actually has chronic fatigue. He's now in remission, but I suggest you learn more about that. I'll put some notes down at the bottom of my video so you can research that more. Anyway, I was tested for enteroviruses and came back positive for Coxsackie B type 3. I'm not going to go into all the other viruses that he tests for. There are many strains of enterovirus that cannot be adequately tested for. So in that case, he does go by other symptoms, and I'll also go over the physical exam he did with me. So when he went over my whole health history, he asked me about any sort of illnesses that I've had as a child or growing up. What I had the most happen to me, I wasn't very ill as a child, but starting in 2010, I came down with some strange stomach problems. And my doctor just said it was stress. My food, like I wasn't able to digest my food. And I had Kaiser Permanente at the time. Hold on to your hats and glasses. I know those of you who are Kaiser people will understand this. He told me it was stress. I went to the emergency room. They did a CAT scan, sent me home, misread my CAT scan. I had to beg to see a gastroenterologist who found that my stomach was like 3 times the size it should be. And finally, after a gastric emptying exam and an endoscopy, they diagnosed me with gastroparesis. The next year, I came down with shingles pretty bad. And then after that, in July, so 2 months after that, I came down with a terrible case of diverticulitis. And I was hospitalized because of that. I actually was in the hospital. They sent me home with a high fiber diet. They thought I was crazy for mentioning my gastroparesis because it was misfiled in my file. My records somehow were mixed up. So they thought I was crazy talking about gastroparesis, that I just made literally that I was making it up. And so anyway, so I was hospitalized, and I was in the hospital for I think 3 or 4 days. And then the next year, I had a terrible respiratory infection. And then I was in a car accident. I was rear-ended on the 405 freeway, and pretty badly. And that's when, in 2013, I came down with chronic. I was pretty bedridden from October of that year until March of 2014. And I'll talk about that section a little later. But Dr. Chia believes that those series of illnesses definitely have something to do with my chronic illness. He did a physical exam on me and found that he has found that in the lower right quadrant, it's a very painful place for me, that most CFS patients that he's seen have pain in this area, and he's got a whole reason for that. But he could tell by doing the physical examination on me, along with my health history, that I definitely had CFS, and he prescribed to me gabapentin for my nerve pain. I don't know if there's anybody out there who takes gabapentin. I've had that to be helpful to you. But he prescribed to me gabapentin and also his herbal supplement Equilibrant, which I just now took my first dose. I was not able, I didn't take it earlier because you can't breastfeed on that medication. And I was weaning my nearly 2-year-old son. And I've been so sick this past month that I just decided today, my husband and I both decided that it was just time. So I just decided that I wasn't going to feed him anymore, which is really sad. But I'm really anxious to figure out if this is going to work for me. I'm going to show you right now the box. It looks like this. It's Equilibrant. It's Dr. Chia's own formulation. He formulated this with his son. I think his son helped him do this. I believe his son is a pharmacist. And the pills look like this. Okay, they come in boxes of 90. This box was less than $50. It was about $50, actually, for 90 pills. And I've heard some comments that say, I don't really trust someone who promotes their own remedies. Just to give you an idea of what this cost me, I'm starting out taking 1/8 of a pill, 1/8 of one of these. So one pill is going to last me for 8 days. So just to give you an idea of how much this costs. Some people take more than that. You kind of build up you need to work up slowly. I would not recommend taking this without a doctor's supervision, because the supplement can be pretty strong. But I understand, you don't need a prescription to take this, or oxymetrine is the Chinese herb that this has in it. So I'll be documenting my progress with this. I literally just took it before I started this video, and I'm feeling a little shaky right now. The piece looked like this. It was just a very small piece. Tastes terrible. Tastes horrible. I can still kind of taste it in my mouth. It's pretty gross. But I'll keep you updated on my progress. Now I'm going to talk a little bit about my symptoms. And one of the reasons why I made this video is because when I saw Jennifer Brea's video, or her movie Unrest, in the first 20 minutes I was totally blown away by how similar her symptoms were to mine. I had tingling in my hands, and I would go through these weird episodes of brain fog, and my hands would curl in, and I would have sometimes trouble speaking and trouble swallowing, which was very upsetting. I'm a musician. I need my hands to work. I teach. I need my voice to survive on my own. I need my brain. And nothing was working right. But when I went in to the emergency room, and I had a friend with me at the time who documented this, my hands, when it happens, it's kind of happening now, but it's not very severe. I can just feel that I have this tendency to pull my hands in. It just feels like a tightness. But when it gets really bad, if I think about it hard enough, I can open my hands, but then it just goes right back to this strange curled, gripped feeling. The ER doctor said that he'd never seen anything like that there was no medical reason for that to be happening, that everything was psychosomatic that I was experiencing, that he would be happy to just send me to the psychiatrist there and have a psych evaluation done. That was very upsetting to me. I went home. Over the next few months, I had some really scary symptoms. Most of the time, my symptoms are the worst in the morning when I get up. I just have this intense need to lie down. And when I'm lying down, I feel somewhat better. But standing up, I just feel exhausted and tired and unable to move. Sometimes I feel short of breath. It's been hard to explain how it feels, other than the best way I can describe it is air hunger. Like I'm just not able to get the full effect of the oxygen that's going into my body. I get this intense brain fog, and it sort of goes away around 10 a.m. It starts to kind of fade away a little bit, so I can actually go about my day somewhat. If I overexert myself, it comes back. There is also a period of time where this just recently started happening to me again, where I have this tightness in my abdomen, and it's very difficult for me to get a very full breath. That's really scary. I had a doctor try to tell me how to, he told me that yogic breathing was, he tried to get me to do more yogic breathing. If any of you know me, I play the flute. I play very large, rare, huge instruments. And I teach people how to take huge breaths. I take full breaths. I know how to do it. So that was very upsetting to me. Someone was trying to teach me how to do something I've been doing for a long time. I get some pretty intense neck pain. It feels kind of like my head is sitting funny on my head, and it's like painful somehow. It's a very aching feeling. I was getting some chest pains also that were very upsetting. Sometimes it felt like I was having a heart attack, which of course, when I'd gone to the ER, they told me I was having a panic attack. And I also asked them to test for Lyme disease at one point. I asked 3 times. They ignored me. Although I had actually had a very strange rash. I used to hike miles and miles several times a week. I lived near Griffith Park in Los Angeles, and sometimes I would spend 4 hours hiking and with my dog. And I did find a tick on me, and I did have a strange like bullseye rash that I just didn't think anything of. I don't know if it was a tick that had bitten me and caused this rash. I finally did have a Lyme screening done, and it was inconclusive. So I haven't really pursued that anymore. That's not even something that I discussed with Dr. Chia. So I will discuss with him that at my next appointment, which is going to be in January. The hardest thing is the brain fog for me, losing track of my thoughts. Hopefully this video is understandable and I'm not going off on too many tangents. I can tell you right now that in the 5 years that I've been chronically ill, I've been in periods of near remission. I was very, very active before I became sick. And like I said before, I would wake up at 5:30 in the morning. I would take my dog to the dog park for an hour. After the dog park, I would take him home. I would go to the gym. I would do a spin class, and then I would do weightlifting. And that would be one day. And then the next day I would go hiking for, a few hours, and all that before work, and then I would go work a full day and teach and sometimes have performances. So I had a very full, happy life. That was something that kept my mind in check. I was super happy with where I was in my life. And as soon as I became sick, it was all about me having depression and panic attacks and anxiety and things that I had actually worked through in my life. And I was doing really well. with. I mean, I was going to regular therapy anyway already before getting sick. And so to hear these doctors really dismiss my symptoms in this way was devastating in the deepest way. At one point, going to the ER, I was actually left in the hallway of the ER. I requested to speak with a doctor, and the doctor declined. The doctor would not come and speak with me. Eventually, I was wheeled to a telephone to speak with the doctor about what other sort of diagnostics that they could do, and it was very clear that she was displeased with even having to talk to me. I know that there are some of you out there that are fighting this right now. I can tell you that Dr. Chia was doing all of this research and helping people, and I had no idea that he was even out there. I know there's people at Stanford doing wonderful work. I had no idea these people were out there doing this work because I was in this system and they did not know how to help me. And I'm trying so hard not to fault the doctors themselves because they're kind of stuck in the system and they have to kind of go by what they know. And a lot of these doctors are really, really overworked in the Kaiser system. One doctor that I saw that I really, really appreciate was Dr. Enos at Kaiser Sunset, who is a neurologist who really helped me try to figure things out. And then he retired. So another doctor took over for me, Dr. Bieber, who also was a great help to me during that time, really trying to work with me to try to figure something out. But the treatment that I received, I finally got out of the Kaiser system. And when I moved to Long Beach, I live in Long Beach now, and I found Dr. Chia through a neurologist. And I just want you all to know that there's a way out of this, out of this cycle of not being believed. There's a way out. And I don't know if Dr. Chia can help me get into remission. I don't know if that's possible. I really hope it is possible. I do know that he told me repeatedly that you are not crazy. I know your doctors have told you you're crazy. You are not crazy. You are not crazy. There is a reason why this is happening, and I'm going to help you fix it. So I'm hoping today that my video, watching this video, will help your family members kind of understand a little bit more about what's happening to you, and maybe you'll want to contact me and tell me your story, and maybe we can work together to for all of us to get better. I would love that. The other thing I wanted to mention is how I've been able to hide it for all of these years. For 5 years, I have hidden how sick I was. And all I can tell you is that somehow, when I get very, very sick, and there's something that I have to do, some task, whether it's performing, whether it's teaching, speaking in front of people, doing this video, somehow I can channel this adrenaline rush and it will like rush through me. And I'm able to do it. I'm able to hide it. I'm able to push it down. I pay for it the next day. All of that I'm pushing down will come up and I'll be in bed the next day. You can hear I'm sorry, my voice is a little bit hoarse. It was also because of this that I was in even more denial, and people that were very close to me were questioning whether or not I was really sick, because I could snap out of it. I could figure out how to get through my day. I even learned to ride a motorcycle because of the adrenaline rush. I could feel terrible, and I would just get on my bike. I bought a Ducati. It's beautiful. I love it. I would get on my bike feeling terrible, and I would start the engine, and I would feel this like pixels go through my body, and I would ride off, and I would ride for miles and miles and miles, and I could do things. The next day I would pay for it, and I would be ill. But I was like, if I can do that, I can do it. I'm not lazy. I can ride a motorcycle. I can play my flute. I can teach. I can do these things. I'm not lazy. I'm not. So I hid it for a very long time. And then I became pregnant, and I'll have another video on that later. But I don't ride my motorcycle right now. My son is not yet 2, and I understand that there are risks involved. When I was riding my motorcycle for myself and I didn't have a husband, what's the worst that could happen? I get in an accident. I already feel terrible. That was the one thing that made me feel alive. I don't suggest you go out and get a motorcycle. That's not what I'm suggesting. But I'm looking here and seeing that my time is up with this video. I don't have much left to say other than stay tuned. I'm hoping that my progress with the Equilibrant will be something good to report back, that I will start feeling better. And until next time, I hope you can be well, and I hope I can be well. And we'll talk soon. All right. Thank you so much for listening. Bye-bye.